All right.
All right, there you go.
And what I did, I looked at your slides real quick.
Let's go.
I tee up really easy.
Oh, okay.
All right.
Are we all on that side? Or we want to see?
I don't care where you
Nah, some over here.
Okay, everybody done with lunch? There'll be no chewing while we speak. All right. I want to thank everyone for, obviously, for coming back from lunch. And I think that we have an excellent program planned for this afternoon on one of the most important topics that we can cover this year, which is on opioids. Rosalind talked to you a little bit this morning about the importance of opioids, and I think that each of us as individual attorneys representing individual employees have run into this problem with the so-called opioid crisis. What is it in reality and what should be done is the topic for this afternoon. And I think that as you listen to all of the speakers today, and as you think through what they talk about and what I hope will be an open discussion about this, we can talk about whether there really is an opioid quote-unquote crisis or whether it's a created crisis. The way that we are going to do this today is we have three speakers. I'm going to go a little bit through their bios and tell you a little bit about them. They're going to give a brief presentation, and then we're going to begin an open discussion with all of you about what is going on in the opioid world and in the medical prescription area for prescription medication, and see where we can come, hopefully at least to some agreement as to what the problem is, although I doubt we can get to any solutions. Our speakers today are Ken Eichler. Ken is a government relations officer for Reed Group and ACOM. He's got 20 years in the insurance industry. And he co-chairs, as he's indicated to me, two committees for the IAIBC or the EIEIO, as the case may be. Peter Kreiner is a PhD research scientist at the Institute for Behavioral Health at Brandeis University and is very involved in the National Prescription Drug Monitoring Program, involved in training and technical assistance. I think all of these gentlemen will give us quite a bit of insight. And we have Joel Morton, who is board certified in family practice and fellowship, trained in sports medicine. He is one of the directors of Summit Pharmacy, in addition to being a practicing physician in Phoenix, Arizona, dealing with patients on an everyday basis. So he has both the pharmacy aspect of it as well as the day-to-day aspect. And he also serves as a flight surgeon for the United States Air Force. So what I'm going to do is first call on Ken to give us a brief overview of what's going on. Then Peter will talk to us about some individual planning, and Joel will give us his views, and then we'll open this up for some discussion. I will tell you, when we were doing the planning for this, that even the discussion over the telephone was quite lively. So that was just to plan this, so hopefully we'll be able to get into quite a bit. Remember, please, to take a few minutes with our affinity partners and exhibitors in the hall. Also, CLE, make sure you fill out the appropriate CLE so that you can get that credit for attending today's program. And the Longshore CLE, just to remind everyone, has been changed to the Magnolia Room. With no further ado, Ken.
Thank you all for having me. Although my credentials may give you the perception that I'm a defense guy, I'm really not. I'm very middle of the road. I'm known nationally to be an advocate for pushing programs that will expedite and facilitate the delivery of appropriate treatment and protections to injured workers, as well as expedite the claims process rather than slowing them down. So please don't perceive me as that defense guy. I am really middle of the road. And the folks, anyone who's familiar with, are folks familiar with the IAIBC at all? That's the Association of the, quote, workers' comp boards across the country. I co-chair both the Medical Issues Committee and the Return to Work Committees, and we're working very hard on the opioid epidemic that's killing many of our brothers, sisters, family members, constituents, and clients. Okay, Willow attorneys are the front line. I'm thrilled to be here because I think you folks are potentially one of the key players that can make a difference in the opioid problem. As I mentioned, opioids are killing our friends, families, and constituents. You're the front line that interfaces with the claimants. The claims adjusters are across the telephone. You understand how things hurt your claimants. You see when patients are not getting appropriate care. And I'm not sure if how many of you are from rural areas, but the more rural we go, the less appropriate care we see across the country. So you are in a position to identify and save the lives of those patients, whether it be literally save their lives or improve the quality of their lives. This is a quote that I got from some of the quotes I'm pulling from CDC. I don't know if anyone's seen the recent CDC slide decks and presentations. They're really good, and I'll provide you links if you'd like. But the opioid crisis in the U.S. is not only debilitating our population, but is compromising the quality of life of our injured workers and their loved ones, in many cases resulting in destruction of families and deaths. I think all of you will agree with that. A good friend of mine is Dr. Thomas Jan, who works heavily with the Suboxone programs to get people off opioids. And Dr. Jan will tell you that when the patients come in with their family members, it's the family members who are usually in tears and tell the stories how they've lost the person they know, which is the injured worker, to the use of opioids, and how it's changed their lives, and how the patients will tell you when they're given the proper medication rather than being over-medicated, their lives change and get back on track. Our goal is to get people functioning in life. Work is merely a subset of life, but we want them to function in life. CDC's goal, and I'm not a CDC member, and by the way, I have the link there, and if anyone needs the PowerPoint, I can get it to you, is to reduce the abuse and overuse of opioids and other controlled prescription drugs while ensuring patients with pain are safely and effectively treated. Patient care has to be number one. And this may be a little tough to read. I know it's tough to read from here. Some statistics that I've pulled from some of the CDC reports. And I'm sending this to kind of tee us up for the rest of the program. The death statistics while striking represent a small fraction of the human, societal, and familial costs, familial and financial costs. I think people are often approaching the defense community thinking it's all about the buck. It's not all about the buck in this case. It's about quality of life across the country. Over 50%, and here's one for you, 50% of prescribed medications are consumed by individuals other than those who they are prescribed for. And that's not limited to opioids. I'd be hard-pressed to find anyone in this room who hasn't taken a prescription medication that was written for somebody else. Whether it's an antibiotic, whether it's an anti-inflammatory, whether it's a pain medication, you can go down the whole list. People take other people's meds, which is the big problem in opioids. The majority of deaths from opioids are not necessarily the individual who the medications have been prescribed to. Anyone here have kids or grandkids around the house? Okay? Whether we want to like to hear it or not, people go into other people's medicine cabinets. Kids, where some of us of a certain age remember when it was parties where you go and you grab the beer or somebody would try and get the alcohol bottle. That's not what's happening. Kids go for the pharmaceuticals. They're going for the opioids, they're going for the benzodiazepines, they're going for the medications that get high. My sister's an assistant high school principal, and I have another family member that's a school administrator, one in a wealthy community, one in a not-so-wealthy community. Same problem. Has anyone here ever heard of a bowl party? Okay, I see a couple of people nodding. Bowl parties are either a two-bowl or one-bowl party. If it's a one-bowl party, the kids grab whatever pills they can at home or wherever they do. They walk into the party, they throw them into a bowl, all the medications are mixed, and you reach in and you take those pills. Kids end up, and young adults as well, killing themselves accidentally. They suppress their respiratory system due to the medication mixes, and they die. The two-bowl parties, the first bowl, you pick up a folded piece of paper with a number on it. That's how many pills you have to take. Kids are dying. A lot of it is, a good portion of it is because they get the meds through the parents that are on workers' comp because doctors are over-prescribing. What happens? Patients fill those prescriptions because the doctor said so. They also prescribe them because if they fill the prescriptions, then it's a perception of something being wrong. Good friend of mine in California who does functional restoration tells the story, and he gets the cases nobody else wants, where everybody's hooked on the pill, on medication. He has them come in. They come in with a bag full of medication. He pours it out on the table. It's either a Ziploc, it's usually a Ziploc bag. Holds up the first one and says, "What's this?" And they squint, they don't quite know what it is. And they said, "Well, what's it for?" And they say, "Well, it's for pain." "Well, how often do you take it?" "Well, I take it every 4 to 6 hours." "Well, why do you take it every 4 to 6 hours?" "Well, the bottle says, take every 4 to 6 hours as needed." And he further questions him, "Well, it says as needed." "Well, the doctor prescribed it, I must need it." This is a true story. These are not things you could make up. So that there is a problem there. This year, in 2010, 16,651 people died of opioid overdoses. Majority were accidental. Deaths from prescription drug overdoses now exceed deaths on the highway due to motor vehicle accidents. Pretty darn scary. Unintentional drug overdose death rates are now 5 times greater than suicide and close to 10 times greater than undetermined drug deaths. So we're looking at things that are really hurting your clients, the injured worker. Went the wrong way. A couple more statistics. 40 to 60-year-olds, surprise, surprise, it really is a surprise because we all think it's the kids, represent the highest drug overdose death rates by age group in the country. And again, it's accidental overdose. For every one opioid-related death, there are more than 150 people who abuse or are dependent upon the opioids. When you calculate that out, it means over 2 million people in this country are abusing or addicted. There are over 4 times more deaths from opioids than either heroin or cocaine. How's that for a bizarre number? There are over 2.5 times more deaths from opioids than benzodiazepines. That's your Valiums, your Xanax, your Klonopin, and the like. This is just a slide, and I clipped some of the slides from CDC. I have the full CDC presentation available if anyone wants it on their own. But as you can see, the opioids versus other drugs, really, really scary. And what's even more scary, or could be predicted as well as scary, is as that climbs up, it ties directly in to the amount of drugs sold in the country. Direct correlations, those lines follow the same path. We compare out opioids versus heroin, cocaine, and diazepams. Look at that spike, and look at where it started spiking. Early 2000s through 2010, and the number continues to climb. We're a drug-oriented society. There are enough, I think, narcotics prescribed to give everybody in this country enough medication for multiple months in 1 year. What's the motivation for opioid guidelines and for control? Patient advocacy. I did say I am a patient advocate. I believe in doing the right thing. And the protection of all constituents should be the driving principle between opioid guidelines and controls. Cost containment should be coincidental benefit, but not the motivating factor. Same thing with treatment guidelines. People think it's to cut costs, it's to expedite. For those of you that are in the big cities, I know there are a lot of